Hello, I'm Dr. Marlis Gonzalez-Fernandez, and we're here today to talk about a really good case, talking about the rehabilitation of people after they've sustained a below-the-knee amputation. In this case, we have a 47-year-old who had a non-healing foot wound. His initial injury occurred 13 years prior to the time when we saw him. It was, as you see in the photograph, in the foot arch, and it was not healing very well. At that point, it was decided that right below the knee amputation, a transtibial amputation, would be helpful for the patient to allow him to perform activities better, ambulate better. So we saw the patient for a pre-prosthetic, pre-amputation evaluation, and we provided recommendations including fall prevention and prevention of knee flexion contractures, because it's very common for people who have lost a limb to actually require more range of motion of the knee in order for it to be able to remain straight. The surgery occurred soon after we saw this patient. It was performed with a traditional Burgess technique, where the muscles of the calf are preserved and brought forward to protect the bottom of the residual limb and to be able to bear weight on that area. So the patient was admitted for comprehensive inpatient rehabilitation 2 days after his surgery. Splinting was used to prevent knee flexion contractures. Again, it's really important for them to be able to get the knee straight so they can actually walk when we provide a prosthesis. And we established at that point important short-term and long-term goals for this patient. For example, he wanted to be able to move around the house independently after discharge from the hospital. That was one of his short-term goals, but his long-term goals included getting back to recreational activities. Before this wound happened, the patient actually was involved in triathlons and was able to do a lot of recreational activities that he really wanted to return to. So in rehab, he stayed about 10 days, and he was discharged home. And when we saw that patient right after the discharge, he was discharged 13 days after the amputation, he was doing really well. He was basically independent for all his activities of daily living. We personally call it modified independent because he needed a device. He didn't have a prosthesis yet, so he was using a walker to move around the house. But he was able to do that. He was able to do his activities, and he was able to walk, again, using a walker and hopping about 175 feet. So this was very important for him to be able to be as independent as possible early on. He was also able to take good care of his amputation site and maintain it properly. So I see him 2 days after that, and at that time we realized that his wound had healed very well, but he still had a lot of swelling. So patients after an amputation have to wear a sock that is elastic. We call it a shrinker sock. They wear it 23 hours of the day. And he still was in the process of wearing that long enough that the swelling had receded. And then we decided to reevaluate him 2 weeks later to then be able to fit him with a prosthesis. So when we saw him after that, it was about a month after his amputation, and his surgical wound had healed, all the swelling had resolved significantly, and we decided that at that point he would be casted for a preparatory prosthesis. And we usually choose to do this because the residual limb will change shape dramatically very quickly. And we want to make sure that he can get moving, that he can get used to the prosthesis, but that we have the ability to change it based on how his limb changes. At that point, he was starting to walk in the community, move around in the community, even though he still didn't have a prosthesis. So 2 months after surgery, was when we reevaluated him. At that point, he had had his preparatory prosthesis for a long period of time. He was experiencing some pain, which is common. He had increased activity at this point, which he didn't have for the previous 13 years. The wound has severely limited the amount of walking he could do. And in fact, I don't think he ever walked any functional distance in the community, meaning that he really had to depend on other people to help him move around. But now he was walking, and that brought in other issues that were tended to quickly. And I had mentioned the preparatory prosthesis. Well, at that point, just 2 months after the surgery, his residual limb had continued to shrink. The swelling had continued to recede to the point that we had to fill the space in the socket of his prosthesis with about 21 layers of socks to make sure that the prosthesis was still snug and the fit was appropriate. He was participating at that point in physical therapy and was improving his walking ability and his ability to walk without showing a limp or demonstrating any difficulty. So if we go to the 9 months after the amputation, at that point he was using 2 prostheses. He was using a permanent prosthesis for everyday activities and a different prosthesis for intense activity and exercise. He was doing very well in terms of overall activity. He was spin cycling about 100 miles every week. This shows you what the 2 prostheses that he has look like. The running prosthesis works as a spring to allow him to go faster and provides the support necessary. And then the everyday prosthesis supports more walking activities by the way the foot functions and the way the ankle of that prosthesis moves. And a year after the amputation, we were happy to say that he was fully independent for all ambulation. He was able to walk and run, including all the recreational activities that he wanted to do. And he was also training for competition. Again, he was used to doing triathlons before this wound developed, and he's looking forward to returning to performing this activity. He currently uses a treadmill about 2 hours a day and is participating in advanced ankle prosthesis trials. So the photo you're seeing right now is a bionic ankle that he was helping some researchers test while he walked every day. So in conclusion, I hope you, after listening to the experience of this patient, you'll understand that limb loss can present multiple challenges, but these can be overcome, and a comprehensive pre-surgical, surgical, and post-surgical plan of care can make progress better and facilitate recovery. The other point that I would like to highlight is that in spite of having 13 years of decreased activity that results in decreased muscle conditioning and ability to perform exercise, with a lot of work and appropriate support, this can be overcome. And I'll leave you with some of the words that my patient said, and I quote, he said, "I like to think that I didn't have the foot amputated, I had it replaced. When thinking of it that way, I understood that I was not losing a foot, I was simply getting a much better and healthier one." So I'll leave you with these words. Thank you for listening today, and please feel free to reach out to us if you have any questions. Thank you.